Hormone health is one of the topics that we often chat about on the show because these bodily messengers are vital for optimal well-being. An imbalance could cause a myriad of complications. So we've invited into the studio Dr. Mark Opperman from the T Clinic to chat to us about hormones and what hormone replacement therapy means in men. Mark, welcome. So nice to have you back.
Thank you, Michael. It's good to be back.
Tell us, hormone replacement therapy. I mean, some people may see that as purely a go to the doctor, get some hormones, get out of there and carry on with life. But it's more than that. Tell us about what is encapsulated in the idea of hormone replacement therapy.
Michael, I think we have a conception, as you said, that it's a prescription of a tablet or a cream and there you go. Actually, a hormone treatment or hormone optimization and balancing involves so much more. It involves lifestyle changes. It involves you having to take control of so many things as the patient. We tend to forget that we have 50 hormones in the body, and each and every one of them, somehow or another, are linked to the others, either through a direct cascade. So, for instance, testosterone that turns into estrogen, or through the hormone's effect on other tissues that then have an effect. And here we can think about what our adrenal glands will have as an effect through the action of cortisol, for instance, which is the stress hormone.
Yes.
So as cortisol elevates, it starts acting on our insulin metabolism, it starts acting on our blood pressure, it determines what happens in our kidneys, and then they can have negative effects on things like our sex hormones, where they start suppressing them if it stays high for too long.
Right.
So all of them are linked, and you cannot look at one without looking at all the others and understanding how they're going to start affecting one another.
Right.
I think in previous episodes we used the analogy of a cake. When I change one ingredient in the cake, that cake's going to taste different.
Yes.
So when you start fiddling around with one ingredient, you have to rewrite the whole recipe. And so often we have people coming into the office who are already on hormone replacement therapy saying that, but this is just not working.
Yes. So what you might find in those patients, I'd assume, is that it's working in some level, but because
Absolutely.
it's changed the cascade,
Yeah.
now it's different. So Mark, it's interesting that you call it hormone optimization as opposed to necessarily purely hormone replacement therapy. So that's getting that recipe just right so that the cake still tastes good. Is that correct?
It's correct, but I think I want to take it a little bit further. Hormone optimization, for me, plays an integral role in preventing the diseases of aging.
Okay.
So the diseases of aging is cardiovascular disease, diabetes, cholesterol. Aging is a disease. So if you have optimal balance in hormone levels, you slow the progression or even stop the progression or even turn around the progression of these diseases of aging, which ultimately kills you.
Yes.
And all of us know that we are living longer. If we look at when we were young, someone in their 60s were old. Now, you know what, the majority of the people are in their 60s and they live until their 80s and 90s.
Absolutely. And they look good in their 60s still.
Absolutely.
So, yeah. So Mark, I mean, there are various kinds of hormone replacement therapy that would be most common, I imagine. What are the ones that you're seeing as being quite important or most prevalent in need in the market that you are working with and your clients?
I think the first one is energy metabolism. And when we look at energy metabolism, I think an easy analogy to use is power generation, and here we can think of Eskom. So,
if it's not working, it's a problem.
Exactly.
Yeah.
The body doesn't function. Everything starts grinding to a halt. So with your energy metabolism, we look at the two big ones, and this is glucose, and here insulin plays a role. So think about insulin as this thing that takes your coal, glucose, and moves it to the power station. Okay, so insulin is responsible for that. So it's the transfer of energy molecules to your cells. And then those energy, the glucose, needs to be utilized. In other words, it needs to be burned.
Yes.
And here we start looking at our thyroid hormone specifically. Thyroid is what burns the glucose in your mitochondria to give us the energy that the body needs in the form of ATP. Now, all of those require cofactors. If we look at our thyroid hormone specifically, you need optimal levels of vitamin D, optimal levels of iron. You need magnesium, you need zinc, you need copper, you need enzyme CoQ10. All of those play a role in different stages. So like with our power grid, if one of these things are not there or not in optimal quantity, that energy metabolism doesn't work.
Yes.
So here we see it in guys becoming, seeing insulin resistance and then becoming diabetic, weight gain, and you actually don't know which came first. Is it the weight gain that caused the problem, or is it the hormones that's causing the weight gain?
Yes, yes.
Fatigue is one of the first signs that we see. Now, all of these things have a role to play on the body's stress reaction through cortisol, which is involved with your adrenal glands. Your pancreas plays a role there as well. These things then start affecting other hormones. You mentioned in your introduction that hormones are chemical messengers. So these chemical messengers don't do the work that they're supposed to because they're unable to. They can't bind to the receptors, or they're not sufficient, or they're out of balance. And now we start seeing changes in cognitive behavior, where we start becoming a little bit forgetful. We start becoming irritable. We have mood swings. There's an increase in the sense of anxiety or depression. And that can further lead to changes in energy levels, as we spoke, and changes in sexual functioning, libido, erectile function, sex drive. All of these are compounded by the fact, for instance, that we don't get adequate sleep. So when you look at hormone optimization or hormone balancing, you really need to look at the patient holistically. It's difficult to get this right, and it requires input not only from your practitioner, but more so from the patient through constant feedback. This is what's happening in the first couple of weeks. I'm changing the recipe. The doctor is the one that's baking, but he never gets to taste.
Yes.
So if I don't get that proper feedback from you on a constant basis, I can't change my protocol to ultimately give you the best possible outcome on a sustainable and continuous basis. One of the biggest contributing factors to imbalances in hormone levels is what's happening in your gut.
Yes.
So, it's so often on this program, we talk about gut health, from your microbiome to diet, etc., etc. Everything starts there. Testosterone, for instance, is a psychoactive hormone, but it's metabolized in the gut, and that metabolites are active. So if things in the gut are not right, but that whole breakdown of testosterone goes out. Testosterone is incredibly powerful in maintaining so much in the body, from cardiac health to preventing osteoporosis, bone mass preservation, to cognitive behavior, motivation, anxiety, depression. It's not only about sexual functioning, but in doing so, all your other hormones in some form or another are involved, from your glucose metabolism to what happens in your kidneys.
So Mark, risks. I mean, I think going back to that idea of the testosterone link, guys who boost their testosterone in what we not quite the right way, and there are risks associated with that, because you may bulk up, but what are you doing to the rest of that cascade in your system? So when it comes to a formal hormone therapy like what you guys offer, Are there risks associated, or is the fact that you're managing it with a practitioner who's checking on everything, meaning that you're going to be in a far better position?
There's two answers to this. Let's just go back and say a lot of people self-medicate either through the abuse of hormones, and here we're thinking maybe of using testosterone or anabolic steroids for physical gains. But this goes further than that, where you self-medicate with products that you take off a shelf. As we said earlier, cofactors like vitamin D, melatonin, DHEA, CoQ10, all of those things can affect your hormone levels. So if you don't know what it is that you're taking and what it's going to do to a certain hormone, you can either mask underlying conditions.
Okay.
And the one that I think we should guard against specifically is cardiovascular disease. And so that's dangerous in itself. Hormone optimization, as we will go through this series, is very difficult. There are great benefits to be had. There are certain pitfalls. There's great risk. And if you do consider doing this, I implore you to seek out someone who does this on a regular basis.
Yes.
Our GPs are great to diagnose certain conditions, but because this is such an involved process with so many nuances and differentials that come into play, you really should consider seeing someone who specializes in it. It's not necessarily an endocrinologist or a physician, but someone that specializes in hormone optimization, and that more than anything else can give you the time that you need, because it's a constant adjustment, especially in the first couple of weeks.
Right. So Mark, people who'd like to find out more, where can they get hold of you, find out more information, and possibly come and have a chat with you?
So the easiest is to use social media platforms, Facebook. Our website is www.thetclinic.com. We're based in Bryanston, Johannesburg. I have a satellite clinic in Umhlanga. The easiest to get us hold of us on 010-824-1393.
Wonderful, Mark. Thank you so much for giving us a good sense of where we're going to go in this series as we talk to you more about hormone therapy for men.
Thank you, Mike.